We're now going to talk about shoulder dislocations. But if we're going to talk about the ball coming out of the socket, we need to talk more about the socket. The key structure of the socket is the labrum. Now the labrum is like a rubber gasket, except in this particular situation it's called fibrocartilage, and it rims the bony floor of the socket that's called the glenoid. Now here is a good picture of what a normal labrum looks like. And here is a picture of what happens when the labrum is torn. I often tell patients that the labrum and a dislocation is very much like a golf ball sitting on a golf tee, and that the golf ball is held on the tee when you have a nice rubber gasket sitting on the tee, and you've got the pull of the rotator cuff muscles that help push it and pull it against the tee. When the labrum tears, you no longer have that nice protection that holds it into the socket, and in this case, the golf ball would fall off of the tee, and that's shown with this picture here. When your shoulder dislocates, of course, you need to have the shoulder put back in the socket. The ball must be reduced. This usually happens in the emergency room. And if this is your first dislocation, the question becomes what to do about this. Now, for my patients who are 16 to 24 who are doing athletic and high-risk activities, the chance of another dislocation is virtually 98%. For that group of patients, I recommend the surgical repair right after the dislocation, because every dislocation carries with it some risk of damaging the ligaments, the cartilage, and the bone. And so after we know you've had one dislocation and you have virtually 100% chance of a second dislocation, I usually recommend that we repair the ligament to prevent that second dislocation. But for the rest of us who are not 16 to 24 and not doing snowboarding, fast skiing, or high-risk activities, what should we do for a dislocation? Well, if you're under 30, there's still a higher risk of a re-dislocation, and in that case it depends on what your activity level is. For some of those patients, I'll go ahead and splint them in a position that gives the ligament a chance to heal, which would restore the stability of the shoulder. And what about the rest of us who are over 35? What happens when you have a shoulder dislocation? Well, the chances are much lower of a re-dislocation. So if you did not tear the rotator cuff tendon, which is possible in that age group, I recommend usually that we treat you with conservative care, physical therapy, restore your motion and strength, and try and get back to your normal activities. And if you get back to normal activities and the shoulder is stable and functioning well, then no further treatment is needed. If you go back to normal activities but the shoulder is causing difficulty with those activities, I then recommend surgical repair to restore the stability of the socket.